88 young adolescents in Kenya are infected with HIV daily, placing hurdles on the country's path towards attaining zero new HIV infections by the year 2030. Now, in these latest numbers issued on Sunday by the National AIDS Control Council, youth in the age bracket of 15 to 24 account for almost half of the new HIV infections in the past year, prompting a revision of the country's HIV eradication roadmap. And as Laura Otieno reports, there will likely be a renewed HIV/AIDS campaign in schools as health stakeholders convene for a two-day summit to address the growing concern of the HIV epidemic amongst the youth.
At Kisumu's Nyalenda Estate, we find 54-year-old Eric Okioma distributing condoms at a local barber's shop. Though this shop is yet to exhaust the previous stock, he refills the dispenser anyway. Eric has been advocating for safe sex among the youth in informal settlements. According to the National AIDS Control Council, 88 people aged between 15 and 24 years get infected with HIV on a daily basis. This demographic accounting for 42% of the new HIV infections recorded in 2020. A number Eric believes could have been lower if the young adults were involved in sex education.
Mashule lazima wajue hao ni watu wenye wanasikiza wamejua kusoma. Msipokaa nao paka pia waseme maoni yao na waongee. Kwa kizungu wanasema call a spade. Mkiongea hapo tunaweza pata solution.
In 2001, Kenya launched the National Condom Policy and Strategy, which subsequently paved way for the free condom distribution program in a bid to eradicate new HIV infections by 2030. In 2014, the Kenya HIV Prevention Roadmap provided timelines which included a 75% reduction of HIV infections by 2020 and suppress new HIV infections by 2030. However, in 2020, having reduced infections by 64%, the National AIDS Control Council is now changing tact, zooming in on the adolescent population and dropping in the Ministry of Education.
It's not a health sector alone. Keeping these children in school is protective. Research has shown that it will prevent them from engaging in early sexual behavior. It will delay their sexual debut and will also reduce their risk of getting those early teen pregnancies.
We need things like structural interventions, which means for them to have even money at the table, running businesses and all those kind of things. We should actually move away from the people who think that we can only reduce HIV by having medical interventions.
In the summit expected to kick off Tuesday, stakeholders from various sectors will convene for 2 days to chart a new course for Kenya in the journey towards tackling the HIV/AIDS epidemic and create space for the youth at the table to tailor sustainable solutions. Laura Otieno, Citizen TV.